A newly released study is linking alcoholic beverages to a mouth bacteria that can lead to cancers in other parts of the body.
Joining us with more details, emergency room nurse and clinical nurse specialist Alice Benjamin. Good morning to you.
Good morning.
So what were the findings of this new research? NYU School of Medicine did the research, correct?
Right, so they did some research where they discovered that people who drink moderate to large amounts of alcohol have changes in their mouth, and our mouths are like ecosystems that have good bacteria and bad bacteria, and that this alcohol, when introduced, can actually disrupt the normal flora and allow negative bacteria to be in a surplus and lead to chronic conditions such as cancer and other health conditions.
And there's already evidence that gum disease can lead to other diseases in the body, right?
Yes, absolutely. So gum disease and any type of oral infection can very well translocate to other parts of the bodies. Our mouths are very vascular areas, so it's very easy for bacteria to enter our bloodstream or for us to swallow them and to enter our GI tract and be absorbed and spread infection and chronic diseases that way.
We were talking about this the other day, that there's alcohol in a lot of mouthwash. So the fact that you're, swooshing with that around your mouth, you would think that would kill germs. Does it?
Well, so alcoholic beverages and mouthwash both have alcohol components. However, the mouthwash, it kills bad bacteria that causes gingivitis, cavities, and bad breath and things like that. It also inadvertently kills some good bacteria as well. Now, think of the context though. I'm brushing my teeth, dental floss, mouthwashing, good oral habits. So those things generally lead to good oral care, good oral bacteria.
Sure.
When we're drinking alcohol, we're not thinking about brushing our teeth. We're usually also eating foods and drinking things that are rich in sugars and starches, which are great which is great food for the bacteria. So it's very different when so you really can't compare mouthwash alcohol to the alcohol that we drink.
But it's, forever people have been having wine with dinner or a beer. Is that what we're talking about? And are there some amounts that we should be aware of?
Yeah, so in this study, they looked at people who drank beer, wine, and also mixed drinks. And so in the spirit of alcohol awareness, I wanted to also go over what are kind of the definitions and descriptions of the drinking that was mentioned here. So when you look at someone who's classified as a moderate drinker, this is someone who drinks on average 1 alcoholic drink a day for a woman or 2 alcoholic drinks a day for a man. So that's considered moderate drinking. So I know there are several people who drink, a glass of wine a day, and by definition, according to the National Institute of Health, it's actually considered moderate drinking. There's also binge drinking, where for women, if you drink more than 4 drinks in a day, for a male, more than 5 drinks in a day within a short amount of time, that's considered binge drinking. And then heavy drinking is someone who drinks alcohol every day or does binge drinking 2 or more times in a month.
Okay, so that would make the difference as to the bad bacteria that we're creating by drinking too much?
Right, because those acids in that alcohol actually stunt the growth of good bacteria and create an environment where bad bacteria can grow. And those bad bacteria, especially specific ones, are known to increase your risk for getting cancer and other chronic illnesses.
I guess what concerns me is that people are the takeaway is you can't drink any alcohol with food, and I don't think that's what you're saying.
No. So obviously you want to drink responsibly and you can enjoy an adult beverage. But I think what's important here and what this research is telling us is when there are chronic conditions and cancers, when we get down to what causes it, sometimes it's some of those things that you actually enjoy that can be causing that. So it's just something to keep in the back of your mind, but then also make sure that you're doing good oral care, right? And following up with your primary care doctor and your physician to see what your risk factors are. Because knowing that, if you might have a favorite drink, but if you know that could potentially cause cancer in someone like yourself, you may, want to change some of your lifestyle habits.
Okay.
Yeah.
Alice Benjamin, an emergency room RN and clinical nurse specialist. You can follow her on social media, and you can check out her website, asknursealice.com. Thanks for coming in.
Thank you.
Good to see you.